Good afternoon, everyone. Welcome to this beautiful session. Welcome to our live webinar. We'll be talking about managing stress and anxiety for a healthy mindset. And we have a guest presenter with us. She is amazing. I went through her profile earlier today and was wowed. It's so amazing that people really care about mental health, about stress management, about our day-to-day life, our psychological health, which is beautiful. A lot of the time we focus on the heart, the organs, different branches, but these days we've been having issues with mental health, and it's awesome to have someone who is a specialist in this area. So here we say is she's a consultant psychiatrist and a managerial psychologist, a CEO of ready-made consulting services. Her profile is awesome. She is a fellow of West African College of Physicians and a member of American Psychiatric Association. And she has received training far and wide in London, University of Washington, Boston, Harvard University, and she's passionate about mental. Today there is no question you have, no matter how silly it is, you think it is, she's here to answer all your questions. And I love it because and have a specialist answer all your questions. And the series of questions. So as you listen, if you have questions, if you need clarifications, just type in your question. She has answered a lot of common questions people ask. And one thing we'll be doing in this today is we won't be calling out names. So it's your information is strictly confidential with us. We'll just read out your question and she will answer. So feel free to ask questions, and you can also make your profile anonymous. You can make yourself anonymous and ask a question in case you're not sure, in case you think we'll read your name out. So once again, welcome, Dr. Gbonjubola. Good afternoon. Nice to be here with you today.
Hi, good afternoon, Janet. Thank you very much for having me. It's my pleasure to be here.
Thank you. Today we'll be talking about mental health generally, stress management, having a healthy mindset. So we'll just jump into it already. So the first question people ask, or I would like to ask, is what is the state of mental health awareness in Nigeria? What is the current state of mental health awareness in Nigeria? We've been hearing mental health, depression, stress management a lot. But currently, what is the state of mental health in Nigeria?
All right. Well, thank you very much, first of all, for having me and for putting mental health on the front burner. I mean, at every opportunity I get to talk about mental health, I have to, thank you for taking the initiative, and it's a very welcome development. Mental health is, like a topic that people would rather not talk about, a topic that people would rather, pretend like it doesn't exist, or that, over the years we have like ostrich with head in sand, pretended like there was nothing like mental health. Meanwhile, people were really, really, really suffering. But interestingly, over time, at least since I started my own residency training program till now, I have seen growth with mental health. While at my residency training program back then at the Yaba Psychiatric Hospital, it was, quite difficult to see anyone come by themselves to request for care. But we started to see a bit of that. People would come in by themselves, request for care, not accompanied by, family members or friends. They would take the initiatives themselves. And now that I'm in private practice, I also see that the knowledge is increasing, the awareness is increasing. There's a lot of spotlight on mental health right now. And I think a lot more spotlight is being shown on mental health because of the COVID-19 pandemic. largely because people had felt that after the COVID-19 pandemic, the next likely pandemic was going to be a mental health, pandemic. And so people were and are still, giving a lot of attention to mental health issues. So awareness has increased, advocacy has increased, knowledge and education has increased. And I think the increase is also largely due to the fact that a number of people who use the service, so service users, that is, patients who have mental health conditions, are also coming out to talk about it. And so NGOs are open for it, private organizations are open for it, the government hospitals are open for it, and then even, policymakers are beginning to give mental health the attention that it very much deserves. So I think we've pretty much gone from a 0 to maybe close to a 60, I would say. Thank you. Hi, Janet. I can't hear you. I don't know if you're muted.
Can you hear me now?
Now I can, yes. Thank you.
Internet here is going on and off, but I believe we don't. So I said, like you said, COVID-19 has opened our eyes to take mental health seriously, because prior to COVID, a lot of people, they've just been living their lives, going to work, coming back, trying to get themselves occupied. But being stuck at home, people started, some people broke down, and a lot of family members started taking it seriously, started paying close attention to these things, and having nowhere to go, they had to start dealing with it directly, compared to before, when they would just sweep it under the rug. So, Dr. Gbonjubolaabiri, there are some people that say those that have mental health issues, they cannot work properly in an organization. If they come out to admit that they have mental health issues, it's a sign of weakness. There's just a lot of stigma surrounding mental health. What do you think about this, and how do you think people can actually overcome this?
Well, I think it's rather unfortunate that this is 2021, and mental health is not getting that attention that it deserves. There's a quote that I like to say all of the time, that it's by Glenn Close, and it says that what mental health needs is more sunshine, more candor, and more unashamed conversation about a condition that affects not just individuals but their family members as well. It would, however, also interest you that it is not only in Nigeria, even in developed Western countries, mentally ill persons, especially people of color, also still get stigmatized and discriminated against. However, I think that if people started to realize that a mental health condition can happen to just about anyone, it's not reserved for anyone in particular. It can happen to any individual, regardless of age, gender, socioeconomic status, and it can happen at any point in time. I often like to say to my practice that what separates me from my patient is time, chance, and the couch. You never know who will be on the other side of the divide, especially because we all go through life, we all face difficult times, and we all go through, traumatic life experiences. And so, for instance, when the COVID-19 pandemic came, what we found was that people were thrown into like a frenzy. We were thrown aback. It was something that we weren't expecting. It was a significant life event that affected all of us in various proportions. And so the only major way that we can continue to, confront stigma is to talk about it, to speak about it, to give mental health the attention it deserves, and of course to remember that everyone at any point in time can come down with a mental health condition. I think that if we start to see things in this light, we may have more empathy towards other people. Thank you.
Okay. Thank you, Dr. Gbonjubola. Sorry, I have serious internet issues in the office, so I've switched to my mobile data. So the next question is: at what stage will you say somebody should seek medical help? Because a lot of people feel stressed, they get moody, they have issues, and they just bounce back, which is normal, but at what point will you say, okay, you need to seek medical attention?
All right, and I feel like that's a trick question because I don't think we need to wait till a certain time. I think that everybody at every point in time should be able to see a therapist. We often wait till, people are tearing up their clothes, they can't sleep, they can't, function, they can't eat, they can't, meet obligations that are expected of them. But the truth is, and I must tell you, there's no time per se. It's not until an individual feels incapacitated that they should start feeling as if they should go and see the therapist. We should normalize going to a therapist. And so you would hear in countries abroad where they would say that, oh, I woke up this morning, I said hello to my husband, he didn't say hi to me, and so I feel bad and I want to go see a therapist. I just changed jobs, I'm having difficulties, getting into the flow of things. Let me talk to a therapist. Oh, I lost my cat, I lost my dog, or I lost a friend or something, or a neighbor, and I want to see a therapist. Unfortunately, on this side of the divide, what we find is that people wait until things start to increase in intensity, frequency, and starts to cause distress to not just themselves as individuals, but to their interactions and also to their work as well. We should normalize going to a therapist to be able to talk about just about anything and everything, and not just wait until we feel like, oh, this is a serious issue, and because of this, I should be seeing a therapist.
Thank you so much for that answer. I think this answers my next question partly, which is some people feel extremely stressed. They feel they are having mental health issues, but they cannot really place it. They cannot narrow it down to, they do not know if it is stress from work, stress from family. They just have a lot going on. So sometimes they do not know, okay, am I having a mental health condition or am I just stressed? So what is that thin line that differentiates stress and mental health issues?
All right, and so I like that you call it a thin line because that's really what it is, a thin line that obscures both. It's important that we all realize that all of us have mental health. But it's also important that we also know that all of us can have a mental illness. And so at every point in our lives, we're actually in between a continuum between mental health and illness. And we can all, tilt towards a certain balance depending on what it is that we are exposed to per time. However, how does an individual know that they have a mental illness? If an individual is unable to cope and function successfully, the functions of the mind. What are the functions of the mind? The functions of thought, emotion, perception, cognition, mood, and behavior. And so when you see an individual start to struggle in those areas of their lives in such a way that it starts to cause distress, disability, disease, an important loss of freedom, and sometimes death. And so when all of these things start to happen, what you find is that the individual starts to complain about these things increasing in intensity, in frequency, and of course, distress also increases. It's important that we know that stress is a normal part of our lives. And so if you were defining what is known as mental health, one of the criteria that the WHO says is that for you to say that you are mentally healthy, one of the criteria is that you must be able to cope with the normal stresses of life. If not because of stress, I may not be at work today. I may just decide, oh, let me just stay at home and just, stress gives us meaning. It gives us motivation. It gives you drive to get up. Stress is response to a stressor. So it's an important part, and it's everybody faces stress. Everybody comes in contact with stress every day. We have internal sources of stress. We have external sources of stress, but identify what your stressors are and know how it is that you can best manage your stressor.
Thank you very much. Okay, I think that also you've been answering all the frequently asked questions together. So it's just it's such a beautiful thing. And you've spoken about the types of the major causes of stress, internal stressors and external stressors. Internal stressors being the things that happen within within us, our thoughts and things like that. And external stressors, things from outside. Even traffic can stress you. Traffic is an external stress.
Yeah.
It's an external stressor. And mental health, like you said, is being able to be stressed, deal with your daily activity, being stressed and being able to bounce back. That is a complete, it's a complete thing. And some people, they do not know how to cope with stress. Any little thing they've broken down. Will you say those kind of people, how will you classify those kind of people, those that easily break down? And maybe because it happens a lot, something that you can deal with, your someone close to you, any little thing they've broken down. So people, and sometimes people see them as weak. Sometimes people see them as not being able to cope with things. How will you classify this set of people, and how do you think they should help themselves?
All right. Well, so what I would say is I wouldn't say that those people are weak, and I would not say that they lack the strength, because when we start to talk in parlance like that, these are some of the things that don't even make people seek help. A few days ago, I saw a young man in my practice who refused to come until things got a bit critical, and I asked him. I said, "Why didn't you come earlier?" He said, "Because I was ashamed, and because I felt that people would look at me as weak." And so it's not about weakness or strength. It's about finding your balance and finding pretty much what we call resilience. So the skill, of course, that you're talking about is the skill of being able to adapt in spite of adversity. And a lot of people in this day and age actually don't have those skills. People have, IQ skills, people have EQ skills, so intelligence quotient skills, they have emotional quotient skills, they have social quotient skills, so they know how to interact with people. But quite a number of people do not know how to cope in spite of adversity. And that coping in spite of adversity pretty much is what we know as resilience. Being able to stand in difficult times, being able to face adversity when adversity comes. Because trust me, life is not a smooth ride. Life is ups and downs, peaks and troughs. Life will throw you quite a number of things that may unsettle your boat. And you can't give up every time a difficulty shows up. It's about learning that that's the reality of life. And so what I always advocate for is that even for little children, let little children know that it's not about winning all the time. There will be times that you would lose, but you must also learn how to deal with failures. You must learn how to deal with losses. I mean, because we're quite religious people, we always try to avoid negative connotations. We reject it and we say back to sender. But the truth is, it is what it is. Difficult times will come, but the individual then needs to learn how to cope in spite of adversity. And I dare say that there are certain skills, and I like to refer to them as soft skills that people must learn. You must learn the skills of communication. You must learn the skills of assertiveness. You must learn the skills of emotional intelligence. And of course, you must learn how to be resilient and thus be able to cope in spite of adversity. Learning of all those skills, of course, sometimes takes you beyond yourself. But most importantly, it teaches that you must be self-aware, knowing your own self, how you feel per time, why you feel a certain way. And of course, beyond self-awareness is also knowing how to regulate yourself as an individual. If you learn all of these things and you also open yourself to the reality of what it is that can happen in life, you're more likely to be able to do well as compared with another person who just always says that, oh, something happened to me, attributes the blame to everyone else but themselves. And that's what we call a locus of control. There are two locuses or two loci of control, an internal locus of control or an external locus of control. And I'll quickly give an example. And so, those years when we did JAM, if they ask you, so what did you get in JAM? Some people will say, I got 240 something. And then you ask somebody else, so what did you get in JAM? You say, they gave me 150. Sometimes we attribute everything that is wrong with us to other people. And that's an external locus of control. But being able to take responsibility for yourself, the things that happen around you, extremely important way of managing yourself in life.
That's beautiful. So the major thing here is sometimes we must come out of trying to wallow in self-pity, because we can just spiral down. When you are facing challenges, actively think of ways to bring yourself out. How can I do this better? How can I cope with this? How can I? Some people, when you tell people these things, some will say, "Oh, you don't just understand," but it is an active thing. You have to consciously do it. If not, you just keep wallowing in self-pity and keep feeling bad. So now, I want to talk about mental health. We'll be talking about mental health, mental illnesses. Generally, when people talk about mental illnesses, the first thing everybody thinks about is depression. Whereas a lot of people don't know that there are different types of mental illnesses, but depression is the most common most of the time. And some people can even have post-traumatic stress disorder, and they'll think it's depression. And I'm sure there are these different types of mental illnesses. But talking about depression now, so does stress does it cause it, or does it make it worse? So looking at depression as a whole, is stress a factor in
Okay.
Did you get my
Yeah, I lost you a bit there, but I heard you say that is stress a factor for depression. I think that it's important that you highlighted depression, especially because depression is a common mental disorder, much more common than we know. In fact, the WHO says that at present, about 264 million people worldwide, regardless of age, gender, or socioeconomic status, have depression. It's currently the leading cause of disability worldwide, and it's a contributor to what we call the global burden of disease. Usually, when we look at the causation of depression, we look at what we call the biological, psychological, and social factors. And the biological factors often result from looking at, genetics. Does the condition run in families? And of course, yes, depression runs in families. You're likely to find it in, offsprings of people who have a mood disorder, or more specifically depression as well. In some medical conditions such as, stroke, diabetes, having a cancer, having terminal, diagnosis, can also tilt an individual to depression. Sometimes we found that some medications have also been, closely linked with causing depression. And so that's biological. For psychologically, of course, is there anything and everything that affects the psyche, how the individual sees and perceives themselves and their skills as individuals. And so you're looking at issues of self-esteem, self-worth, confidence levels, personality. And what we've often found is that anyone who feels, less of themselves as an individual will definitely be unable to carry themselves as well as they should. And this, of course, can also tilt to depression. In fact, there's a particular cluster in the personality profile that we refer to as cluster C, where you have the over avoidant, the dependent, and anxious personality types. They are the ones who are likely to, have or come down with depression. And last but not the least is the social causes of depression. And so when you look at the social causes of depression, you're looking at conditions like unemployment, poor financial status, poor housing, lack of access to funds when you need it. And it is in this area that I would say that, well, people can then start to talk about feeling exposed to stress, or feeling like some of those factors can be stressful. And so I had mentioned earlier that, stress can be internal causes of stress or external causes of stress. Sometimes the expectations we put on ourselves as individuals, oh, I have to buy that ashwebi, oh, I have to go to London for summer, I have to go to America for, winter. Sometimes these things are real. Sometimes it's school fees for children. Sometimes it's someone trying to get married. Sometimes it's someone in a relationship and trying to, be better for their partner. Sometimes it's, when are you going to get married? Sometimes it's, oh, you have all boys. When are you going to give us a girl? Sometimes it's, you have all girls. When are you going to give us a boy? Sometimes it's even at the workplace. It can be how your boss does not think that you're performing as well as you should. And so all of these things, yes, can be internal and external sources of stress. And when an individual starts to feel like, they're not good enough, so depression is largely about negative perception of the individual, the world, and the future. We often refer to it as what we call the depressogenic schema, or the triad. The person who is depressed feels negative views about themselves. I'm not good enough. About the world is not a great place, and the future. And of course, if this individual is continuously, thrown or shown these negative things, which can then be stressors, of course, the individual is well on their way to a depressive episode.
Thank you very much for your insightful response. Now, I'm going to ask a very tricky question here. And the question is, there are some people that they commit suicide later on we get to find out that they were depressed before that happened. And a lot of people will say, but this person was a very jovial person, full of humor, full of this, full of that. Literally was literally the happiest person in the room before that happened. Why does that happen most of the time? Like most of the time, they're always the happiest people, not knowing that they are suffering. Is it like a cover-up, or why or how does that happen? I would love you to explain that to us.
All right, so we often try to say that people die by suicide, not commit suicide, because the word commit often connotes that it's a crime. And so, there's an overrepresentation in the diagnosis of depression being the cause of suicide. And that's because some people who actually die by suicide, it may not have been depression. It may have been impulsive. And so all of a sudden, this individual just feels like, gets a text message that says that the 200 million you owe today, you have to pay tomorrow. And the individual knows that there's no way I'm going to get that from. That's impulsivity. For some, it's in response to voices that people hear. And so in some psychotic illnesses, some people hear voices that command them to do certain things, either hurt themselves or hurt others. And so some people have died by suicide because they responded to a voice that was speaking to them. For some, it's substance abuse. And so you find it in substance abuse such as cocaine or alcohol, where the individual just suddenly goes on to take their own lives. Sometimes it may be a personality problem that allows the individual to want to, end their own lives. Maybe a borderline personality disorder. So suicides have been there for a long time, but depression is not the only cause of suicide. When you talk about the fact that, individuals look like they have their lives all going on. I remember the story of Kate Spade and Anthony Bourdain, who looked like they had everything everyone would want, and yet they still decided to take off their own lives. And so I dare say that the truth is that quite a number of people are behind a mask. A lot of people, you're not seeing what it is that is really going on. We see appearances, but appearances can be false. And we see appearances even when we talk about conditions like masked depression. So there's a depression that is called masked depression, smiling depression, also known as functional depression, where this individual appears to everyone else that they've got their life going on together, but deep inside, their lives are actually tearing up, they're tearing apart. So, of course, it takes a very high index of suspicion. You may never know. And so, when they used to tell us in those days that HIV, they show for face. Sometimes you will never know that these individuals are struggling. But people do struggle. Sometimes they talk about it. Sometimes we may be able to tell when we're close to them and we notice a difference in pattern in, maybe their speech. They say, I'm tired of life. What are we even here for? They just, throwing in the towel, not giving their best, maybe at work, reduce productivity, or their personality is just changing. They usually are the ones who bring up all the lights to the room, but once they come in, they want to be in an area and not speak to anyone. And so I think that it's important that all of us, regardless of whether we're professionals or not, must have a high index of suspicion at all times.
Thank you very much for that. So at least now will be more, I'm sure people will now start looking around. You're too happy today. fine. But also anxiety disorder is a type of mental illness. But again, where is the thin line? Is it, of course, it's okay. It's okay to be anxious. You have a deadline all over the place. You're worried. You want to just meet the deadline. And when does it tilt to anxiety disorder or panic attack? How can we differentiate these two? Is it every time someone has something and you're anxious, does it mean that you have a disorder? Or how can we really explain this?
All right. Thank you very much. I like that you added that anxiety is normal. So like stress, anxiety is the normal part of our lives. And so if a young man or woman should go for a COVID test today and the result is not yet out in the next 24 hours and 48 hours after you're still expecting your COVID results, we know how anxious that individual will be. However, when the result now comes out and the result says negative, you expect the person to say, wow, hooray, I don't have COVID, I'm going home. But if that individual then starts saying, no, go and check again, that's not my result. Or maybe they didn't take enough samples. Or was it that their kit was expired? You know, the individual just starts looking for every reason for the COVID test to have been positive. And so, like I said, anxiety is normal, but you expect that once that result comes out, the individual is fine and says it is what it is. However, it is then said to happen when the rest outlasts the threat. It's bigger than the threat that was put to it. And so, for instance, in this situation, you expect that once the COVID result is out, the individual says that, oh, thank you, I'm going home. And so anxiety then becomes a problem when it starts to increase in intensity, frequency, and starts to cause distress to the individual, does not allow the individual enjoy the relationships around them, enjoy private relationships, relationships at work, and they cannot even, their productivity starts to suffer. And so there are quite a number of, anxiety disorders. You have generalized anxiety where the individual is just afraid about everything and anything, not because there's any reason to be, they're just afraid. There are panic disorders, like you said, the individual just goes into a panic mode and, their heart starts to beat faster, their respiratory, the body pretty much goes into, a state of alarm. But when this thing now continues for days on end, and of course, the individual cannot function anymore, we say that an anxiety disorder has come into place because it's no longer a trigger, a response, and it's over. That little trigger has generated so many responses that the individual does not even know how to stop it anymore and may need help at that point in time.
Thank you so much, Doc. I think that was a perfect response, and I've even learned a lot from that because there are times I want to know, like, okay, does this person really have a problem, or is this person just responding to what is happening, what is going on around? And we can tell when there's some people that even when everything is resolved, they're still all over the place. So the next question now is, we see it a lot on the news. There are some channels that they always talk about suicide bombing here, this happening there, this person is doing this here. A lot of bad news, a lot of things going on the TV. Does this affect our mental health, and will you advise that people should reduce such? Because some people just like getting information, knowing what is happening everywhere, having in Syria, this is happening, in Pakistan, this is happening, in Israel, this is happening. Does this affect us mentally, or should people stay away from things like this?
All right, so information and knowledge is good, but I must say that you must know what it is that you can take. And so I'll use myself as an example. And a few years ago, I would be sleeping in the middle of the night and I'll just suddenly wake up. And I'll wake my husband up and I'll say, do you know this is how people are sleeping in their homes? And Boko Haram just shows up.
Wow.
And he had to tell me, you need to stop watching the news. At a point, I would sleep and maybe I sleep up in the parlor and somebody's playing an adventure game on a PlayStation or something. And in my dream, I'm actually in a war zone where they are shooting all around. Wow. And so I realized that at that point in time, while I needed information, I also had to be able to get information that would not affect my mental health. And so as much as possible, I get information, sometimes secondhand, but of course from verified sources. And I'm also quite careful about how much information I, expose myself to. And so what I would say is, as an individual, know yourself, know your triggers, know what sets you off, or what can put you, in a bad place. I remember when the COVID-19 came, a couple of people had reached out because there was this infodemic where people were just sending all sorts of information, including what was true, what was false, what was not verified, just because people were trying to get followings on social media channels.
In fear.
I think that, yeah, exposing yourself to news that you may not be able to, and news can be traumatic, no matter how little it is. I remember watching a clip of a video many years ago. In fact, I came across it by accident when there were these ALU boys, and that scene has never left my head, because the mental health conditions that can happen include, poor sleep, depression, anxiety. It can even, make an individual in a bit to want to forget, to start looking at abusing substances, of abuse, alcohol, marijuana, to mention but a few. And so we must be able to, know what our triggers are, understand ourselves, most importantly, of course, share news that is responsible sharing of news, even if you must share news to anyone, not just flood everybody's timeline because they follow you on WhatsApp with all sorts of information and you don't even give them, an advance warning like, oh, this may contain a video or a graphic that you don't like. And I think, to end that up, I would just say what the good book says, that we should guard our hearts with all diligence, because out of it flows the issues of life. And much more importantly, whatever things are true, whatever things are kind, whatever things are helpful, these are the kinds of things we should think about. So don't get me wrong, get information, but also don't get information that can harm your mental health and put you in a very bad place. Thank you.
Thank you very much for that. So the next question is, how will you advise, because sometimes we are not the ones going through depression or traumatic situations, anxiety, and a lot of time these people, they do not have access to therapy, to see a therapist. They do not, they are unwilling to see a specialist. And people always try to wonder, how can I help this person? They see their friends, their colleagues, someone close to them suffering. They are lovable people, but they have this issue, this mental illness, and they do not know how to help. How will you advise such a person? How will you tell the person to?
So just like there's first aid in physical health, there's also first aid in mental health. And the first aid that we say is, psychological first aid. And so that's what I would tell anyone who is thinking about how to help a friend, a colleague, a relative, or a loved one. They're called the 4 L's. L for lollipop, the 4 L's. And the first L is that you must learn about mental health. Learn about mental health, learn about mental illnesses, learn about mental health conditions. Not because you want to come down with any of these things, but because you want to be able to identify it when it happens and be able to take steps. The second thing, of course, is that I would say that we should look out for each other. Be your brother's keeper. Look out for them because you care and because you love them enough to, understand what it is that they're going through. You want to understand their challenges or whatever it is, whatever issues that they're facing. So learn about it, look out for them. The third L will be to listen to them. Listen intently, attentively, in a kind, compassionate, and non-judgmental manner. You must listen to them and listen to what they're saying, not what you want to hear. Let them talk and listen to them because you really want to hear what they're saying. And the last L is that when you do find something wrong with these individuals, please, by all means, link them with sources of support. And so the sources of support may be a therapist. The source of support may be someone who would help them financially or someone who would listen to them and speak to them. It may even be their church pastor or their imam who would be able to find a way to speak to these individuals, or an elder. But by all means, once we see that we have learned, we have listened, we have looked out, and we found that there just might be something wrong, what we should then do is link these individuals with sources of support where they can get the requisite help that they need.
Okay, thank you very much. I would like to tell the attendees that you can start writing down your questions, because we'll be rounding up the FAQs soon. So just start writing your questions, and once we are done, we'll take all your questions before we round up. So the next question, Dr. Gbonjubolaabiri, is how can people deal with persistent depressive disorder? There are some people that they have issues, they want to help, they want to get help, they seek help, they get better, and they start feeling moody all over again, they start feeling depressed all over again. How can they address it? How can they come out of this? Though I know this is not a one-time thing for everybody. There are some people that they just they get depressed, they are fine, and they bounce out, they come out of it, and they're okay, they're able to deal with it. But there are some people that they keep tilting back. How can they address it?
All right, so I feel like you took the response right out of my mouth by saying it's not a one-day thing, it's not a one-journey thing. And it's important that we all realize that recovery is a journey. Recovery from whatever it is an individual may be going through. And so many times the word recovery is synonymous almost always with substance abuse. But even in conditions of, physical health and mental health, people are trying to recover. Recovery is a journey. And you must remember that many mental health conditions are actually chronic illnesses. Once you understand what is wrong and you can identify what it is, knowing about something gives you a bigger edge as compared with somebody who doesn't know. And so I would assume that, this individual who has gone through multiple depressive episodes is also seeking professional help. While there's some, depressive episodes that an individual may be able to solve by themselves, maybe a mild depressive episode in reaction to something. And then even if it is a reactive depression, I would say, still speak with a specialist who would be able to guide you and teach you skills to cope with what it is that you're going through. Now, I want us to try and understand that quite a number of symptoms we see as mental health symptoms are actually, fruits of a tree. Meanwhile, the bigger problems are actually at the root. And so if anybody, including myself or yourself, walked into a therapy room, trust me, we would find something. And we would find something that it is that you haven't been able to, effectively deal with. Sometimes, many of those things that are some of the factors that make depression reoccur over and over again. We often say that depression is linked with loss of a loved one, loss of a loved position, loss of a loved item, loss of something that you had wished that you could attain but never got to. If you come to a therapy session or you see a therapist, you would learn how to cope with, seasons of your life, including the good season and the difficult seasons as well. But what I would say is anyone who is having recurrent depressive episodes should please, by all means, be speaking to a therapist. Your therapist may then say that you would have psychotherapy, professional talk therapy. They may say that you need to be on medication. And there's no therapist who will put you on medication except you need to be on medication. And sometimes it's as seemingly little as touching the social, circumstances around you. But whatever it is, whatever condition the individual has, the plan is usually individualized to meet that person's needs, tailored to meet their own needs. And of course, would go through what is called the biological, the psychological, and the social approach to care. Thank you.
Thank you, Dr. Gbonjubolaabiri. You were talking about medications earlier, and I would merge my last two questions together so we can start taking the questions, because we've spoken a lot about this. So some people don't want to take medications, or they skip their meds because of the side effects. How will you encourage somebody who is having side effects of these medications to deal? How can they deal with it? And what are the non-medical treatments that people that will be beneficial to people who have mental illnesses?
All right, thank you. And so I'd like to, write on the back of what it is that I had said earlier, that unless entirely necessary, no one will put you on a medication. Also, is the fact that when a doctor puts you on a medication, the doctor puts you on a medication that has the least possible side effects in response, of course, to your clinical, clinical issues at the time. And so when the doctor sees that this individual is getting better, they start to drop the medication. Not every mental health condition is treated with medication. Some mental health conditions can be treated with psychotherapy, which is talk therapy. And the talk therapy, of course, also differs. Is it a cognitive behavioral therapy? Is it a dialectical behavioral therapy? Is it a trauma-focused therapy? So you can see there are different kinds of therapies. I can keep going on and on about therapy. And then sometimes it's social intervention. Social intervention can be, taking the individual away from where they live to somewhere else, taking them to a controlled environment so that they're away from the triggers. Sometimes it can be an occupational, therapy assessment and intervention, where you need to teach this individual about, anger management, assertiveness skill training, self-esteem enhancement. And so medication will be recommended for individuals that need to use medication. I know that, one of the reasons why many of our clients do not like to use medication is the side effect profile. But another reason is also the fact that because the brain is the organ that is ill, how does the brain tell itself that it is ill? And so quite a number of these individuals do not even know that they are ill and would, just say that, okay, I'll take it just because you said so. And so what we should continue to do is to educate and inform them about the benefits of taking medication. 2 days ago, I sat with a patient who has been this is the 3rd admission in 6 months. That's not good. It's already looking like poor prognosis. And I kept saying to her, why don't you just try and take this medication? She said, I just don't want to take them. There's nothing wrong with me. And I said, walk this road with me. What do you think the cancer patients will say if the cancer patient had a choice about a medication that could keep them on for so long? They will jump at it. They will beg for it. And I just had to tell her that, as we all grow older, we also start to take medications for different things. Nobody wants to, but sometimes the need overrides the want. And when that situation comes and it's important enough to take medication, we will recommend it by all means. But remember that, of course, we often give the medication with the least side effects because, of course, we care about the health of our patients.
Thank you very, very, very much, Rick. I'm sure we can't thank you enough for this beautiful opportunity. Thank you so much. One person wrote, this is so educative. Thank you so much, Dr. Gbonjubolaabiri. I'm sure this has been enlightening to everybody. And again, talking about medications, one of the reasons why some people don't even like going to hospital is because they'll load me with drugs, I won't function properly again. I'll start that thing you people said I have, I'll start manifesting it. So it's good to hear that medication is always the last resort. That's beautiful. So now, thank you so much once again. We'll be taking questions. We'll be taking questions. So I'll be reading out different questions right now. So the first question, someone wrote, I have a 12-year-old brother. He's going through depression at such a tender age. Each time I sleep, I overhear him saying things like, he cares for people, but nobody cares about him. When people needed nobody cares about him when he needed, when people needed his help. He's ready to render. He's ready to render, but nobody gets to bother about his needs. I think what this person is trying to say, like, he's always saying things like nobody cares about him at such a tender age. How will you advise this person, Dr. Gbonjubolaabiri?
All right. Well, thank you very much for the question and at least for being vulnerable enough to share. Like I had said earlier, mental illness is no respecter of anyone, regardless of age, gender, or socioeconomic status. And so it's not out of place to say that this individual in the period of adolescence, where actually a lot of adolescents actually come down with depression and anxiety problems. And that's largely because, that time of their lives is such a delicate time. The psychologist Erik Erikson described it as a time when the individual is trying to find the balance between identity and role confusion. And so even in the conversations that this young man has, you can see him saying, I am there for others, they're not there for me. Finding identity, who wants me, who loves me, who is willing to do something for me. And so what I would say is, let's get that young man talking to somebody. Let's get that young person, man or woman, talking to somebody as soon as possible. For us to still be hearing those things, it's a cry for help. But this is a cry for help that is being verbalized out. It's been spoken. It's not keeping it in. And so while we can still hear it, let's get this person, let's point this person in the direction of help. And I'm sure that Avon Health will be able to help us effectively do that as well. So please, let us get help for this young person as soon as possible. A lot of adolescents are struggling. And the earlier we can help them, the better it will be. Thank you.
Thank you so much for that beautiful answer. The next question, someone wrote, can stress make someone cranky most of the time? What are the ways to relieve stress? Sometimes people associate headaches with stress. Is that true?
Well, so stress can show up in different ways. And it's different for different people at different times. Even in the same person, stress can look different at different times. And so, yes, stress can make you unduly irritable, cranky, you're shouting, you are, you cry at the drop of a hat, you cry for no reason at all. Of course, that means that you are overwhelmed with stress at that point in time. And for an individual to have been so stressed, to be so overwhelmed, it's the fact that, their ability to cope, the stress has exceeded their ability to cope, so they can't cope as well as they should. And of course, it also means that they've been exposed to too much stress at that point in time. And so, one of the things that I would say is, one, know yourself. Who am I? What are my limits? What triggers me? Know your triggers. Try and make sure as possible that you are not the one putting stress on yourself. Like I said, some of us, by putting unrealistic expectations and goals, are some of our own biggest stressors. So try and identify what your stressors are. Try and, itemize what your stressors are. There's certain things we actually stress about that we shouldn't even be thinking about. And so we can pack some of those things at one side. Some things we look at as stress, they may be important, but they're not urgent. Have an itinerary, have an idea of what it is that you want to do per day. And don't let another person's stress overwhelm you. So one thing that I always say is that sometimes we take other people's emergency and put it on our own selves. Let everyone take care of their own, issues. But of course, if you feel like you're overwhelmed by your stress, you may need to talk to somebody. Talking to somebody and even learning how best it is to delegate tasks, to outsource, to, have, an itinerary per day. Those seemingly simple things may actually be the things that you need to help you ease off your stress. Thank you.
Thank you so much for the beautiful answer. And I would just like to chip in something very little. Is because you're someone close to you can deal with stress better. You see them bounce back and they sort things out quickly. Doesn't mean you have such ability, and that doesn't make you small. So, like she said, know yourself, know what you're capable of, know your limits. So, because sometimes pressure also can just trigger stress and just make it someone start having headaches. How will I do this? My colleague has finished, this person has done this, how will I do mine? How will I do mine? So just do things at your own pace. So next question, and also I would like to encourage people, please ask so many questions, ask as much questions as you can, and even if you do not know how to ask as an anonymous person, you can just write it in, and we won't call your name. We won't mention names. We'll just read out your question, and Dr. Gbonjubolaabiri will answer all your questions. So the next question, the person wrote, I want to appreciate the moderator for the stress-related questions and to answers provided. However, I wish to ask what solution or stress-free questions or stress-free solution to one who do not have high expectations, but conditions have hampered him in solving day-to-day running of a family when demands come from immediate family, especially the little kids.
So social issues or social causation of stress. And so, one thing I had learned to say during the COVID-19 period, and that I'm still learning to say now, is we must look out for each other. And looking out for each other, I mean, if we look at ourselves, nobody has enough. But I attended a course a few days ago, and in the course, one of the things that was said was it was a course on refugee trauma. And one of the things that was highlighted over and again is how the refugee, all that he has in the entire world is the backpack on his back. And with that backpack on his back and his life, the breath in his lungs, is all right. No matter how little it is that you have, you can always share what it is that you have and give someone else. The truth is that, you know, no matter how we talk about it and how we talk about, oh, people can go swimming, they can do yoga, they can go to the beach, they can take a walk. There are people who are faced with real life issues of, you know, children who have to eat, spouses who have to fend, children who can't go to school. People are struggling with all sorts. And so what I would say to you is try the best that you can do, because these things can actually, you know, be depressing and stretch an individual out. But in whatever situation we find ourselves, I would encourage us to be our brother's keepers, to reach out to people. I often say one thing, and it's that caring for others creates resilience. If you care for other people, listen to them, listen to their stories. It helps you understand and take a walk in their shoes. That while you, well, and it's okay, you can spend your money buying whatever it is that you want to buy, but sometimes the things that we buy will feed an entire family for a week.
Sure.
Yeah, let's not, while not making it look like we're trying to indulge people, let's be kind. Let's be empathetic. Let's realize that other people are going through rough patches. And whenever it is laid on our hearts to help and support them, please, by all means, do the little that you can. Thank you.
Thank you very much, Dr. Gbonjubolaabiri. So the person who wrote earlier about the 12-year-old boy continued writing. Person wrote, he's always complaining about his classmates not liking him, hurting him always. And what they said to him has resulted to him not talking to anyone. It baffles me a lot because he goes so cold and unresponding sometimes. The person also wrote, a lot of times he talks to himself, even when there are people around. It is scary. My question is, what can be done to help him? It looks like it's getting out of hand because he's too young for all of this. Thank you.
Well, yes, by the description that you have given, talking to himself, it definitely is getting out of hand. And so what I would say is, I mean, the first thing that came to my mind is, I don't know what Avon Health would want to do, but we at Tranquil and Crest can, you know, provide support for that child. And not just the child. We also do school programs where we can, you know, go to the schools and enlighten those other students. Because of course, what they're doing is bullying. They may not understand it. They're just making that little child be the butt of the jokes, not knowing that they're, you know, breaking down that individual. And so we must do all that we can. We may be able to start with one, but you never know how much of an effect we'll be able to, a ripple effect we'll be able to put in place. If, for instance, well, we partnered on this one and decided to take that one child and that one school as a pet project. It's something that we wouldn't mind doing as a CSR. And so we put it back on the table of Avon Health. We want to know what you want to do, but we're willing to help with the child.
Okay, at the end of this, you would give us, you just talk to us briefly and talk about Tranquil and Quest too. So we'll still do that at the end when we're rounding off. Let's just take these few questions as we go and move forward. So the next question is, I've become lethargic after a series of losses. How do I pick myself up?
All right. Let me commiserate with you about the losses. It's I can only imagine what it is that you're going through, and losing a loved one can be tough. And now this individual has said a couple of losses, not just one. Losing, you know, anyone or anything that is a prized possession to you also, of course, puts you in a difficult place, and also puts you in a position for mental health stress. Mental health conditions can happen. And so what I would say to you is, when a loss happens, as an individual, you will respond, you would grieve. We all grieve when we lose someone. But the truth is that many of us don't know how best to grieve. In fact, there's really no best way to grieve. There's really no best time to grieve. But a best method to grieve will be to go for, or to reach out for what is known as a grief therapy session. And so in going for a grief therapy session, the therapist, of course, will expose you to what grief is, will explore the grief that you have suffered with you, and will also teach you how it is that you can come to terms with the loss that you have suffered, in ensuring that, of course, you are able to live a better life. The therapist will, of course, not be able to change the fact that that traumatic experience has happened, but will be able to teach you how it is that you can, continue to understand how to navigate the terrains of life, and of course, take good care of yourself in spite of the losses that you may have suffered. Thank you.
Thank you very much, Dr. Gbonjubola. The next question is, how can I help someone who I think has some mental challenges if the person doesn't open up?
Well, so that can be tough. And I think it's one of the most, I was going to write something today, and I was going to say, what's more challenging than having a mental health problem? It's not knowing that you have a mental health problem. And so that was, going to be because I was reading a book titled, I Am Not Sick, I Do Not Need Help. And so, I said earlier that the organ that is affected when an individual is mentally ill is the brain. But of course, if I had pain on my hands here, what would tell me? My brain. And so when my brain is sick, how does my brain tell itself that it is sick? It may never be able to. And so it may then take, friends, family, loved ones to help the individual go through that difficult patch. And so in this book that is titled, I Am Not Sick, I Do Not Need Help, it was written by the relative of a young man who had a mental health condition that we call schizophrenia, where the individual had, unusual beliefs and unusual perceptions. They started to have hallucinations, but he did not believe that he was sick. And so what is advised to be used in such a situation with such a patient or such a client or such a family member is what is called the LEAP approach. LEAP like you're jumping, LEAP. And so you listen again, listen to them, listen to what they have to say, not what you want to hear, but what they have to say. Number two, be empathic towards them, their thoughts, whatever desires that they have. The A is that you must agree with them. Both of you must come to an agreement of some sort. And so this individual may say to you, oh, Janet, all I'm trying to do is get a job. But I know that what this individual needs is to get their mental health back. And I'll say, you know what, I hear you. I know you want to get a job, but I also want you to get your health back. And the P is that you partner with these individuals. That's so, you see, we all have a goal in mind, but this is what it is that you need to do to get to that journey. It may not be easy for you as a relative or a friend or a loved one. And so you may need to speak to someone that the individual respects or to a professional who you believe will be able to speak to them. Thank you.
Thank you very much, Dr. Gbonjubolaabiri. The next question, I think what I said we'll do at the end, towards the end of the this webinar, we have to move it forward. The next question is, could you recommend good facilities that offer therapy, preferably virtual therapy? So please, can you please speak about your beautiful facility and what you do? Thank you.
All right, so thank you very much for the opportunity. We are Tranquil and Quest. Tranquil and Quest is a private premier mental health and substance abuse rehabilitation facility. We are located in Lekki. We have 2 branches in Lekki, one in Lekki Phase 1 and one at Ibuefon. We are an offshoot of an international parent body that is known as Gen Psych, that has over 9 branches in America, in different states in America. And so we're pretty much just, replicating best international practices from all over the world. We provide services 24/7, 365. We have a team of well-established consultant psychiatrists, clinical psychologists, occupational therapists, and mental health nurses. And so we have a very rich team. And beyond psychiatric care, of course, we also do inpatient care. We do outpatient care, intensive outpatient care. And of course, we do a lot of psychotherapeutic interventions. And of course, even before the COVID-19 came, that has made again, the world, much more of a global village. We've always done, virtual consultations. And so our consultations are open to people pretty much around the world. And so we get consultations from the US, the UK, just about anywhere. And so, yes, you can sit in the comfort of your room and reach out to us for help and support. However, I would like to sound that if your therapist at any point realizes or recognizes the need for you to come in for a physical therapy session, that will be recommended to you. Thank you very much.
Thank you so much for that. I'm sure so many people noted that down. The next question is there a way to deal with depression apart from seeing a therapist?
So Janet is laughing and I'm laughing too. And so I would say, so depression is a clinical diagnosis. Depression is not sadness. We can all be sad every once in a while, oh, we haven't heard background, you haven't heard alert, somebody promised you something, they haven't given it to you. However, when an individual is depressed, it means that the individual has been in a state of persistent low mood for at least a 2-week period. Low mood, low interest, lack of energy, and quite a number of other symptoms that have started to affect the individual's functioning, their personal functioning, their occupational functioning, their relationships. And so what happens is that depression is not just a condition, it's become so disabling that the individual can't function. If it was something that people could handle by themselves, trust me, you wouldn't need a therapist. But when you see depression, even the person who is depressed would reach out to a therapist. It can be quite difficult to deal with. And so you need the expertise of someone who has walked that road before, understands what it is, and knows how best it is to manage that condition. So please, if you feel like it is depression, if it looks like depression, if it sounds like depression, if it feels like depression, please, by all means, get help from a professional.
Okay. Thank you so much for that. Okay, am I back? Sorry, I went off for a bit.
Yes, you are. Yes, you are.
Okay, I'll read that again. Say your work comes with so much pressure and stress. How do you cope with this? How do you Did you get all my question?
Well, I didn't hear you, but from the little that I heard you talking about coping with workplace stress. Is that it? Hi, Janet.
Okay,
hi, Janet.
I'm back. I'm back again.
So I said I didn't fully hear your question, but I had something about workplace stress. Is that it?
Yes.
How to cope with workplace stress? Okay. All right. So yes, stress can happen everywhere, including at the workplace. And workplace stress may be because of the design of your task, the design of your workload, not knowing what it is you're supposed to do per time, not being properly resourced for the position that you've been, taken for. It may be because you have an overbearing boss. It may be because you have a boss who is not impressed by whatever it is that you do. It may be because there's bullying in your workplace or there's sexual harassment issues at your workplace. But whatever it is, again, be able to identify what your stressors are. In fact, what I find these days is that a lot of young people, especially Generation Z people, are leaving the workplace because of, stress-related issues. They're just like, no. I don't think that I can cope with this. I'd rather just stay at home. And so I think it's a good time to talk about a program that we offer that is called the Employee Assistance Program. And what the Employee Assistance Program seeks to do is that it offers support to employees wherever it is that they work. It is a service that is taken up by the organization, depending on the organization, to cater to not just the mental health of their staff, but every issue, regarding the staff's life. And so mental issues, legal issues, financial issues, it's a bouquet of programs, and it's something that we offer here at Tranquil and Quest. And so if your organization is one that does not have the EAP just yet, please, by all means, encourage them to get the EAP. And of course, in addition to that, you would also start to learn how best it is to, manage stress at the workplace. Thank you.
Thank you so much, Dr. Gbonjubolaabiri. And the last but not the least question. Okay, there are a couple of more questions, but we'll just try to round up now. I'll take 2 questions at a time. Do antidepressants affect fertility in women? And what are the consequences of banging or nodding your head, nodding on the location where the brain is? I believe that's the head. So what happens when someone is always banging their head on the wall or something? I believe that's what the person is trying to say. And does antidepressants affect fertility in women?
All right, well, so thank you very much for the question on antidepressants affecting fertility. And so here's what I would say. Quite a number of factors can cause depression. Our medications may not be directly implicated in being associated with infertility and depression. However, some underlying physical or mental health conditions can cause hormonal imbalances. And so when hormonal imbalances start to happen, that can, lead to infertility in a woman. Sometimes, even though on very few occasions, a few antidepressants have been recorded in literature as affecting hormones. However, that's why when you do start to, work with your therapist and there's a need for medication, the doctor will do a general investigation to look at the state of your organs before we even commence the medication. And if we find that there are any underlying, issues, maybe a PCOS, an hormonal imbalance, we would also ensure that we work in hand with, other individuals. So maybe a gynecologist, a family physician, whoever else it is that we need to work with. So please, it may be touted or popularly said anywhere else, but antidepressants by themselves may not be enough to cause infertility in women. Other causes of infertility also exist. And so whoever has, issues with infertility should be thoroughly investigated to find out what the underlying cause is. The second thing about head banging, a couple of things came to my mind when I heard that question about head banging. And so I'm thinking, is this in an adult? Is this in a child? Is this in a child that has maybe an autistic spectrum disorder? And so any issue with head banging, so it's like saying you just want to keep ramming your hand into a wall. It would suffer injury at some point in time. It will become sore. After a while, it will become numb to the point where the individual continues to do it. And so what happens if an individual continues to nod or bang their head against, an object, is the fact that the brain undergoes what is known as a traumatic brain injury. And so the brain is continuously brought into contact with what is known as the skull. And so while we may not see the injury, the brain may start to bleed. The brain may start to, collect blood in certain areas. There may be, injuries that we may never see. And again, we may never see those injuries because every time there's a problem with the brain, we can't keep going to look inside. It is the behavior that, at the end of the day, we may see. So if you know such an individual who is head banging, please let them see a professional. And so that professional, in this case, may be a neurologist to find out what the underlying issue will be. But by all means, please see a professional. Thank you.
Thank you so much, Dr. Gbonjubolaabiri. And I think we'll wrap this up with this comment. It's not a question. The person wrote, "This is not a question. I just want to say this has been really insightful. Thank you so much for putting this together." And I'm sure kudos goes to Dr. Gbonjubolaabiri. Thank you so
Kudos
much.
to you too,
Thank
Janet,
you.
and the entire team at Avon HMO.
Thank you so much for taking our time to join us and to speak to us about these things. You know the nitty-gritty of these things, and you've been able to explain these things in basic terms, in basic words. So before we round up, I'd love you to just, if you have thoughts, insights that will just that will benefit everyone, just to wrap up, if you have anything to say apart from these questions we've just been bombarding you with, if you have any other thing to if you have any other thing to add before we round up.
Okay, I think if I had anything to add, it would be that I would encourage us all to take our mental health seriously, put our mental health on the front burner, guard our mental health. So you see that your mental health is like a candle sometimes. And so when situations happen, all that you're trying to do is so that that candle doesn't go off. Sometimes in trying not to let that candle go off, you need to say no to certain people, places, or processes that continue to drain you and drain your energy. If you can't say no to those things, you need to learn how best to manage those situations. Again, with the soft skills I spoke about earlier, communication, assertiveness, emotional intelligence, and learning resilience. What you must, guard your heart at all times. Know what your triggers are. There's nothing wrong with seeing a therapist. There's no shame in it. And so many times, people look at us and say, okay, you are saying, see a therapist, see a therapist. Do you see a therapist? And so if you want to hear, the answer is yes, I see a therapist. Because some even therapists go to therapy, and there's nothing wrong with it. If my car had a problem, I'll take it to a mechanic. I won't fix it myself. I don't know what to do. And so if my brain is not functioning as well as I think it should, or I feel overwhelmed, I would speak to another professional. Let's normalize the conversations about mental health. Let's be kind in the words we use about people who may be going through a mental, health condition. Let's teach our children kindness, empathy, because it's what they see us do, what they see us say in our language. We need to start changing the language to change the conversation about mental health. I think the last thing I want to end with is a quote by Vikram Patel that says that mental health is so important and it must not be left to the mental health professionals alone. And, I always like to say this whenever I have an opportunity to speak. Please remember that there is no health without mental health. Thank you very much for your time.
Thank you so much, Dr. Gbonjubolaabiri. This is me giving you a round of applause from hundreds of people that joined. I would like to say, if you missed anything, if you want to go back to anything, we will upload the full clip on our YouTube page at A1 HMO. So please do not hesitate to go to our YouTube page at A1 HMO to watch this video again. It will be more educative. At least you would you can fast it forward, you can take it back, you can write things down. You said so many things that I was even trying to pen down, but knowing that this will be available on YouTube, I can go back and watch it again. So we have come to the end of this beautiful webinar. Thank you so much, Dr. Gbonjubolaabiri. It's been a pleasure talking with you, talking to you. Thank you for your insightful, very explanatory answers. And there are so many thank you messages, and we couldn't take all of them. So, you've spoken about your facility. We penned down your address. So anybody that wants to get to know, to find out more about these things, they will definitely reach out. So thank you so much, Dr. Gbonjubolaabiri. Thank you so much, and do enjoy the rest of your day.
All right, then. Thank you very much for having me, and thank you everyone for staying on the call. Have a beautiful weekend. Please, let's not forget it's the weekend. Find time to rest. Yes.
Bye.
All right, then. Bye. Well, let's do it again.